Hi everyone, it's Dr. Gambhir. I wanted to talk to you today about Botox for depression. So Botox in no way is a cure for depression. Depression needs to be managed primarily through psychotherapy, through primary depression medications. But Botox has been reported by many patients and now is being studied actively as an adjunct or an add-on medication for depression. There are certain muscles in the face that we activate more when we're not feeling well. For some of us, that muscle is this muscle right in here that shows stress or anger. This muscle in here also depresses the brow. There are lower muscles in the face which actually depress the lower face. And as we activate those muscles, sometimes it creates a feedback loop to our emotions. So taking away the activation of those muscles, forcing the face to look in a very natural way, but a little happier, can sometimes break that cycle of depression. And again, this is not a primary treatment for it. Although not studied as actively, if we have other areas of the face, such as the folds or the cheeks, which are dropped down, which can also indicate a little bit of sadness on the face and create that feedback loop as we take a look at ourselves, gentle elevation of those areas, again, in a very natural way, can also help in case reports to just alleviate those depressive symptoms from the outside in. We'll always give you more information in the office. Hope to see you soon. Bye-bye.